In a three-part hematology system, the blood cells are all counted and assessed using impedance technology and are then displayed in three separate histograms: platelets, red blood cells, and white blood cells. Platelets, also called thrombocytes, are defined as the cells between the set lower and upper discriminators, where the x-axis represents the size of the cells in femtoliters, and the y-axis represents the number of cells. The normal curve should show a Gaussian distribution in between 4 and 30 femtoliters, where both ends of the curve touch the baseline. The lower discriminator is fixed at a set value, whereas the high discriminator can be floating or fixed. If a floating discriminator is used, the analyzer will look for the minimum level of the histogram curve in a set range. If a minimum count can't be found, the analyzer sets the upper discriminator to a fallback value. The mean platelet volume, denoted as MPV, is calculated from the area under the peak. MPV equals the sum of the size of all counted platelet pulses divided by the number of platelet pulses. MPV represents the average size of the platelets. The platelet distribution width, PDW, is a parameter that shows the variation in platelet size. If the platelets vary little in size, the PDW will be low. If the platelets vary much in size, the PDW will be high. Large platelets are counted in the tail of the curve. These are reflected as PLCR, platelet large cell ratio. If the PLCR is very high, this can indicate large platelets, also called giant platelets. Small red blood cells, also called micro-RBC. Platelet clumps. If there are very many platelets present, this is called thrombocytosis and it will result in an elevated curve. If there are very few platelets present, called thrombocytopenia, the curve will instead flatten. An abnormal high at the low discriminator could have several causes, such as a high background count, cell fragments, bacterially contaminated reagents. If this occurs, check the background, and if needed, run autorinse and look for findings of cell fragments in smear. If the abnormality persists, check reagent for contamination. An abnormal high at the upper discriminator could have several possible causes such as giant platelets, platelet aggregates, microcytic red blood cells, red blood cell fragments. The reason for the abnormal high at the upper discriminator is that the analyzer is unable to differentiate in between these cells and complexes as they are very similar in size and the populations therefore merge. If this occurs, the instrument may flag for abnormalities in PLCC, PLCR, and PDW. Verify findings in smear. If the platelet histogram show a sharp increase after the upper discriminator, this can indicate platelet clumping or the presence of microcytic RBC. Check for platelet aggregates in smear. If the curve displays multiple peaks, this is an indication that there are more than one population of platelets in the sample. This could have several possible causes such as a recent platelet transfusion, a patient recovering from chemotherapy, platelet clumping. The reason for the two peaks is extreme anisocytosis showing varying size in the platelet population. If this occurs, the readings of PDW, PLCR, and MPV may be affected. Proceed to confirm the dimorphic populations in smear.